Hey, how you doing? Today we're at the Riou Plastic Surgery Center and we're going to inject Botox in Carla, who's our assistant here. So she's been nice enough to show how that works. Now, Carla's 37?
36.
36, totally healthy. And her concerns are wrinkles on her forehead primarily. Is that right, Carla?
Yes.
So raise your eyebrows and show off that little bit of wrinkling there. You can see it's pretty usual pattern. The most common complaint that patients have are the 11 frown lines right in the center there. Make a mean face. She doesn't have much of it. Go ahead. Go ahead and make a mean face. Let's see. Yeah, that's a mean face right there. So she doesn't have much of it, but if I exaggerate, you can see it's two vertical lines here. And then raise your eyebrows high. Okay, that you can see pretty clearly. She has, come on closer, you can take a look. So raise your eyebrows hard. You can see there's 1, 2, 3, 4 rows of wrinkles there. So what we typically do is hold some ice on there, and we're going to do that right now for a little bit. In the meantime, can you see pretty well? Let's take a look and see over here as far as the muscles are involved. So the ones that typically patients complain about are the 11 line there, and they can either be symmetrical or not. And then sometimes they'll complain about a wrinkle right at the root of the nose that's horizontal. So the muscles that are involved in creating these wrinkles are the corrugator superficialis right here. There's 2 of them. They cause the vertical wrinkles. And then the procerus, which is down here, when it contracts, causes this horizontal wrinkle here. On the frontalis, which is what Carla's complaining about, those are the long horizontal wrinkles that people have on their forehead, and Carla demonstrates that pretty well. And that's a result of contraction of what's called the frontalis muscle. So it's a broad muscle of the forehead. So frontalis causes the horizontal wrinkles. Typically, the wrinkles are at right angles of the contraction. So it contracts up and down. So the 11 are caused by the corrugator supercilialis. So above the brow is what that means in Latin. And then, so there's 2 of those, and then there's 1 procerus. And the procerus contracts up and down, so the wrinkle is horizontal, similar to the frontalis. The other wrinkles that are often complained about are the crow's feet. So they go in this direction, and again they're at right angle to the contraction of this muscle, which is the orbicularis oculi. So you've got the orbicularis oris, which is around the mouth, and you got the orbicularis oculi, which is around the eyes. So the orbicularis oculi is what causes the crow's feet. And unlike these, which go in one direction only, this is concentric around the eye. So if you're squinting hard, it exaggerates these wrinkles right here. So the important thing about Botox is it only takes care of animation wrinkles. So those are the wrinkles that get worse when you contract each of these muscles right here. So if you're at rest and you're not moving your face at all, the wrinkles are called the static wrinkles. Those are not improved by Botox. So if you look at Carla, for instance, you can take that off for a second. Turn your head a bit so no one can see you. So rest your forehead, don't do anything. So she's very young and does not have any static wrinkles. So when she's not raising her eyebrows, her forehead looks totally flat and beautiful. But when you raise your eyebrows, like when she's animating her face or she looks startled, basically the frontalis is contracted. Go ahead and do it again. And you've got these very prominent horizontal wrinkles caused by the frontalis. So basically what we have to do is use Botox as a neurotoxin to prevent or freeze that muscle from contracting. So you can tell that if there are wrinkles without movement, which are called static wrinkles, Botox will have no effect at all. It only takes care of the wrinkles that are caused by the contraction of those muscles. The frontalis, the corrugators, the procerus, and the orbicularis. So we're going to use today 25 units, and it's really important to know how much is being injected. The bottles typically come as 100 units, and we just divide it into four 1cc syringes, so each of them have 25. It's important to compare apple to apples, because some surgeons or dermatologists dilute it 5 times or even 6 times, so you'll have 20 units or less. So when you're comparing price, a good way to do it is compare it per unit, so that'll even everything out. But it's important to note that 25 cc will usually just be enough for 2 areas. So if somebody comes in, most commonly it's the frown line and the forehead. That's usually enough, at least in women, to do just 25 cc's. In women, they have thinner muscles. Men typically have thicker muscles, and oftentimes will need twice as much for their forehead wrinkles. But in this case, 25 should do it for these 2 areas. If all 3 areas need to be addressed, if patients ask to just use 1 syringe, we're going to have a mediocre result on all 3 of the areas. So it's important probably to do 2 full syringes if you're going to do orbicularis, procerus, and corrugator and frontalis, because that's too many areas to do just 25 units in. So here we're just going to do 1 syringe, which is 25 units, and we're going to target the glabella, or the frown line. The glabella is the medical term for it. And that's the 11 lines that are caused by the corrugator, and the horizontal line that's caused by the procerus. But Carla's main complaint when you ask her is the forehead wrinkles primarily. So a good part of this will be to target the frontalis muscle. So it doesn't vary very much. Come on closer a little bit, Melanie. The way to get a good result, you can see I'm forcing that 11 line. The procerus is pretty close to being in between both of the inner parts of the brow there. So that's going to be our 1 injection. And what I typically do is I inject 10 different shots for a 1cc syringe, so it's 0.1 per injection, or 2.5 units. So the first one's procerus. The next one we're going to do right at above the inner part of the brow on both sides, so you can make that symmetrically. And the muscle extends a little bit higher and further out. So the next one's going to be 1 centimeter up and 1 centimeter lateral, so right about there. And then the same one on this side, right about there. So that's 5 injection. That's going to be half of our syringe, and that'll take care of the single procerus and both corrugators. The remainder of the syringe, raise your eyebrows high, that part varies a lot, because some people might have more forehead wrinkles in the center, others might have more lateral, some only have 1 line. Carla has more shallow wrinkles, but more of them. She has a total of 4 lines. So since we only have 5 more shots to do, you have to target them as efficiently as you can. The other thing that's important, you might have seen patients that only got it in the center and then they have the V deformity. That's because you need to do at least 1 beyond the pupil line so that it tapers it off. Otherwise you'll end up having too much effect in the center, not enough on the side, so they have the V kind of deformity there. So it's important, raise your eyebrows high. So we're going to start one right in the center. We're going to do another right lateral to it on either side. And I'm going to do 1 more, raise your eyebrows hard, basically lateral to that on both sides. So we're basically going further than where pupil line is. So if you spread that out evenly, you won't get that defect of the V deformity. So that last little one is going to feather it out and prevent that from happening. You have to be careful not to overdo it laterally though, because then the brow can drop, and that's not desirable either. So that's pretty much the pattern that we're going to use here. If there's a lot more wrinkling here, or it's a male, I'll typically use 2 syringes, so inject a lot more shots, so 50 units typically on a male that has very thick muscle. Other than that, it's pretty straightforward. So that's pretty much the distribution of the 25 units right there. One's going to be the corrugator, so we have 2 of them side by side. This will be the right one, and this will be the left one. So right above the inner part of the brow, and then 1 right above it. Now the next one's the forehead, raise your eyebrows high. The other thing I'm looking at is where the blood vessels are. You can sort of see the veins behind it, so you try to avoid it So here's a central one, and here's on either side of it. And here's the peripheral one right there, and the peripheral one right there. We've got a tiny bit more, so I'm going to go right in the center on either side. And there we go. So hold pressure right there, and that's about it. Thank you very much for watching.